COVID-19 testing may have slowed down over the holiday weekend, but medical professionals say they expect an uptick in the next couple of weeks. Kayla Green joining us now live from Brighton with more on this. Kayla, can anyone who attended a holiday gathering just go and get tested at this point?
Adam, not exactly. You're still going to have to meet the criteria of a direct exposure or be showing COVID-19 symptoms. Now, experts say that there's some steps you should take to save time before just rushing off to a testing site.
We definitely are concerned about what the holiday bumps will look like.
Rebecca Alley is the Vice President and Chief Nursing Officer for Ambulatory Services at Rochester Regional Health. For people who may have gathered with friends and family over the holidays and want to get tested just to be safe, Alley says screening testing isn't recommended.
Anything related to the need for testing, we very much encourage you to call your primary care provider first. There are better times to test than others, especially around asymptomatic exposure.
She says a COVID test is a point in time. If you are infected, she says the test shows whether your viral load is high enough to come back positive.
And so you may have attended a holiday gathering, 3 days ago, could have potentially been exposed to COVID, but if I tested you today, you may not come back positive yet. We know that there's a 14-day window that we have folks quarantine if they have a direct exposure. If you don't have a known exposure, all that test is really telling you is that you are COVID negative or positive in that moment in time.
If you believe you've been exposed, you'll still need to meet the criteria of a direct exposure to be tested.
A cumulative 15-minute period in 24 hours, unmasked contact, at least one or both individuals indoors in a 24-hour period of time is the sort of technical definition of direct exposure.
She also says when it comes to symptoms, one general symptom without a direct exposure may not qualify for testing. She says showing multiple symptoms, someone at higher risk, or of course that direct exposure will qualify. Live in Rochester, Kayla Green, News 8.
All right, Kayla, thank you. Now, if you don't have a primary care provider, you can call 922-CARE to talk to someone about symptoms, exposure, and if you should get tested.